Good afternoon, everyone. It is Thursday, May 21st. I just want to remind everybody that starting next week, we'll be doing these updates Mondays and Thursdays at 11 a.m. for the foreseeable future. Premier Savikataaq will give an update, but then he has to go and join a call with his Premier colleagues. Dr. Patterson will give a statement, and then we'll go into questions, and Dr. Patterson and Minister Hickes will both be available. Thanks.
May 21. Pinasaako siulaktu mi naggadyaw mi amalu sitammer mi to saktit sige hatalaktu go ile apaminga ulasakut dana sibulekti kalimalau lunian ichauti ya halanga makalaw tiko katimalanga mata sibulekti katingilo luta Patterson ko sitsa kalangayok amalu apersusitako atu inaulangayok luta Patterson amalu Minister Hickes.
Nunavut bluku chapape Ublumimitikin do ta na nuban na 19 nunavut iluaning ito holi ta na kawenak to amata na ublumimitikin ligo 972 kawiyak to himayo nuba 19 kanging mangata ama 223 huli utak kayabut hungi mangata ublumi ta na kano nunavut government nga amata ko nang minili kan ukyak padlaw yang na mga kan ukyak padliana mga ta na tampani unika wala to kihani pianing igaya mahuli ta na ikpakago nga hakketin niya lang na dapaw ta na kan ukyak padliana mga kahubad liana mga ta nubu iloni ta ko pekoyaw ngito na pekoyaw yut ta na nubu mi meneret chawa aptigo ta na matchalo ni outla chal luni piya kang matan na pianing gaya mahulit utak ke chal na po ikpakago ta na hakin niya lo tabun okak kanwa sunga ta na pianik palya malanga kawiyama yung ay himay na ilani ko ta na hundwa na ito na hulya kakalawang ito mat na po nga ta ko nunabun miut utak ke chal ta mata tukihiw mata ta ko hote apiga kang mangata manaw yok ta ko kahutilok pata kanumya pilerukta ta ko pilera himayawud am ako suta ta ko pekoyaw ngilaw malitsa law tawud ta mo kayuhing inak pata ta ko hubadikalo titan nuwan na yo kay na pat ay tok tu yudlo apta tan na pijuto suni ta ko madiga katcha tabut amata na ukwer te padlelak pa kahuti padlelak pa ta ko nuno builon e pa ko yo ta ko nang minilit malitcha na ko ta ko madigaw na tut pigak pata tan katinga chaluta amma pilera katigi chaluta kihani tan anu wanna 19 halega ne artigo kangek ti malugo amma ikpakago pigalugo tan Monday ublakut amma Thursday ublaku 11 muarangan pitang nelek tugut hanat teleoranik kangan ublaku 11 muapat amma hitamani ublaku 11 muapat pitarang na tugut mat now you. Good afternoon. There are still no confirmed or probable cases of COVID-19 in Nunavut. As of today, 972 individuals have been under investigation, and we are still waiting on the results of 223 individuals. We were hoping to unveil our reopening plan to ease restrictions and measures today, but we are still finalizing some elements to ensure the safety and well-being of Nunavut Mute. This needs to be done correctly to ensure our plans will be successful and will work in Nunavut for Nunavut Mute. Thank you for your patience as we complete this important work. Our aim is to make this public early next week. In closing, I want to acknowledge the boredom and the awareness we are all feeling. COVID-19 fatigue is real, but that doesn't mean we should let down our guards or ease up on the good work we've all been doing. If anything, Nunavut's measures show that staying attentive works. Being tired or bored doesn't mean this pandemic is over or that we should take it easy. I am recommitted to working hard and staying strong We all need to do this together to keep our communities safe. Let's have each other's back and be responsible for one another. We will be back on Monday at 11 a.m. And for the next update, and all the Nunavut mute, have a good weekend. Thank you.
There's no sound apparently, so I'm trying to get that sorted.
No audio? Okay. Okay. Sign language? Yeah. Kick it. Kick it. Yeah. That's a Kent. That's actually a NASA-defined maintenance technique. Yeah.
I just do that from our camera operators.
Yeah.
Work for the pawns.
So you're working on the TV and not on the feed, the CBC feed?
Okay.
Like the online streaming?
Yeah, I get messages from people saying there's no sound, so.
I'm trying to determine that.
Okay.
Okay, so TV is working, it's the streaming that's not working. Okay.
So likely just a CBC.
Okay.
Okay. So we can go ahead.
Questions?
I've got an announcement. Yeah. All right. Good afternoon. I am pleased to announce 2 items today. The first is that Rankin Inlet now has the ability to provide testing if a positive case is confirmed in territory. I'd like to commend the medical and laboratory staff, especially Matt Stacey and Dr. Jasmine Pawa, who have been working quite hard to become acquainted with the Gene Expert machine and to ensure that it can be managed safely, efficiently, and accurately. Getting this machine up and running is a significant step forward for Nunavut, as this allows us to meet our criteria for in-territory diagnostic capacity. When coupled with the fact that we still have no confirmed cases of COVID-19 inside Nunavut, we have now met 2 of our 3 conditions. While the situation in southern Canada continues to play a role in our approach moving forward, we are now in a better position to consider reducing some restrictions inside the territory.
Unusakut huviatunga luminaluna sigun nakamamakkulo ang wanik sivulek kangasinakmi khawisak biugun naksiyok surlunu vadjoanak tumi khawiyok ang kanunavummi. Vimi kanayak Niraktaw yumik awla taot seakon nakulugat tanang itukut awla nikat seaklo ni amalutam maksimakat tangillo ni tan nakawiyas ako tiyok allo kaya ako tigmakaluyok Nunavummi tay maato agaw galen ni malit seakon naksinakat nakawiyas ako naksinang mutamani Nunavu iloani tako ataw tsikko nalunag taw si mayo kaptin nagunong badjoan nak 19 mi Nunavummi makunik Pingasugya kaptilugi malit daw galen malit sila angot isimalaktegun kisa nakalunani tamani kana tami suli isumalun nang nakaluak tilugu sivumugyak panlego ta haktiluta kisa nakaw na amas samilaktigu tamakko ilangi khasyo daw gyakum naksilalang ata malit daw gya kaptitaw Nunavummi.
I have one other piece of news I would like to share. Moving forward, Kitikmeot medical travelers receiving treatment in Yellowknife are no longer required to undergo the 14-day isolation period, and instead will be permitted to return home immediately. This decision has been made through consultation with the Northwest Territories and is contingent on there being no active cases of COVID-19 in the Northwest Territories. Please note that this is for medical travelers only, and this is only when their treatment is provided completely in Yellowknife. Any medical traveler who needs to leave the Northwest Territories to receive treatment in other cities in Canada will still be required to complete their 14-day isolation period. For all medical travelers to whom this new rule applies and who are currently in quarantine, we are working to get you home as soon as possible. As always, our main goal is the safety, health, and well-being of Nunavut. I would like to thank you all for your patience, understanding, and support as we continue to care for our families and communities. Thank you.
Asikan ni nganit tau tu sakat sakak tu nga. Sibumugiak na tiluta, hitir miunian na biliakat tarelit, Yellowknife mut, ulo ni 14 ni anit tailigiakat jagun nirtun. Kisian angit katsaw tigikat tarun nalalik tun. Tana isumali ko tau simayo tu sa katigiyaw law sa tinunat siya miut. Amalu kisiani Nunavut 19 hangin ningani nunat siya mitay may katanyak to. Tana na biliak tu aw lagalin no kisiani tuyo. Amalu Yellowknife me kisiani inulisak tau simaguting. Ana biliak simayo aw lagalin nunat siya sila tanut asingin nunalipaw yang nukanatami suli ulo ni 14 ni anitay lititaw ga katanyak to tuyo me vinni. Ana biliak tu limangan tag nanutak ato agaw na elektok malitaw gahang na ato manaw yok anit tayo titaw yun ni tayo mga kaptitaw gaswa kalawak to si kilami unik pakon tayo mga lima to kaga kakata at tanak tumi tayo litit sinang mo kanwi tayo litit sinang mo inusikat saktit sinang mulo Nunavut muni kuyan na mayroon mo yan silo na si utakit siya akong nakatsi tukisiat siya katsi ikayo sut siya katsilo tayo maipigo supaliaga sa aktilo ta ilat tinik nunakatit tinilo.
Ken Driscoll, APTN National News. Dr. Patterson, the medical travel patient who contracted COVID-19 while in the South, is there anything you can tell us about their condition? How are they doing?
Ken Driscoll, APTN, kung nitay na Nunavut nakatati minyo nakalawak tayo anak bilak si mayo kanuilik ka?
Doing well. Stable, remains in hospital, but is in a general COVID ward, not requiring intensive care unit at this time.
Dahil masuk kapalialo ang ito, kanuingit sunilo. Dahil Nunavut 19, may ipigayaw may tayo makaanak may suli unit si mayang.
Thank you. And the Premier mentioned that there were a few things that still needed to be accomplished in order to start loosening restrictions. Specifically, what do you need to see that you haven't seen yet to start loosening those conditions?
Sibulik tiyo kakamatahan na piyakir tayo ngilaka jumapang na tiyo kasutit si Valian ang mumalit tayo galin ni kisut suli ka magiyaw gakang mata.
It's working with stakeholders and partners to ensure that there's plans in place so that when restrictions are eased and we start to reestablish social connections, that we can do so safely with minimum chance of spreading COVID or any other infection widely.
Pilih hati-hati gue ilau kata gue alin ni tan napang nauti pijak tahu kaswati logo takwa kasujaw balle ani ati logo ulo anak tumitit sit taili gumagatta so lo ino kati balle katalak tilogi taman na iluling asula kitsakta makanoy lingal latala mga.
Rajni Sharma, Nunavut News. Dr. Patterson, as you are thinking about making the plans for easing the restrictions, what are you finding the most challenging?
Rajni Sharma, Nunavut News, kunik luta Patterson, kanoy sumabita ko kasujaw balle ani ati logi kiso ayok na panguban.
It's a lot to coordinate. There's a lot of moving pieces in order to do it safely. And to do it in a manner that makes sense to everybody, and we can accomplish all of that across the territory.
Amisu tuki mo apitau ga hangata pilih hat kaya hasutalo amisu ni taima ulo ka nang ituku taima tuki sinat siak tukulo Nunavut mi taima hasutit si valle agumana kata.
Dr. Patterson, what kind of criteria are you using to ease the restrictions? By that, I mean, like, what kind of factors are you considering?
Dr. Patterson, kisuni malitaw gailin na to agang may sumagaya kakit tarko kasuyaw wala naktilugin malitaw ko sumayatin.
There's a number of things that affect the risk of contact between people. One of them is the number of people who are gathering. The other is the duration, how long you're together. The longer you're together, the more likely transmission is going to occur. And the nature of the contact. Casual contact from 6 feet apart has some risk, but not very much. But close and intimate contact, like you might get in a massage or at a hairdresser, that carries a higher risk. So we're using those three factors to gauge it and working at the lowest risk and working up to higher risk from there. And the other factor that I didn't mention is that some people are more vulnerable than others. So putting emphasis on protecting elders, for example, that'll be lifting the restrictions at care homes will be one of the last things. Sorry, Uli, went on too long.
Adjiging ito taman nato na hamna to sulu inoy katikataron nang ningit amalo katsyo kataron nang mga ta katikataron nakto amalo kanutige katimakataw na mga ta sulu katimakutan na sa tilugi sa naksagun nangat amalo kako katitele katam ni sulu 6 feet ni ungasin nilim metay mata ulugan tugalo kisan ulugan nang inaksaw gunangat tay malo kanilo akto ni kamagayaw nek surlo massage nukinik kasusaydi ubalo nuyaliriji taman na suli suma saksiyo ko tigatigo tako pinga suli ngayo ka isa ko tibut surlo ulugan nang inapame ulugan nang naksamo tako ilangi dalo na yaktaw balya na yakto ajiging itumik ilang ilo tamak ko kaniman nakta naksawsung gunang ata sulu inutukay takwalo pulara ta gunang ningi kingulik pango gajang miyo inutukay angit ilang kakakbiyo pulara ta gunajang ito suli ako ni.
And also, Dr. Patterson, what kind of criteria has to be met in order for you to lift the self-isolation period in Edmonton, Winnipeg, and Ottawa?
Dr. Patterson, kisuni ato aktawiyalin ni maligahang na kita ko, excuse me, halunan ito yung may to Edmonton, may Ottawa, may Winnipeg, Milo.
They have to be pretty much down to no or very little community transmission in all three, and Quebec as well, sorry.
Tako pingasuni halunan ito pataw kayot ni Nunavut anak takakon ni siya makipatakisyan ni Taiman. Anik tayo lakatakon ni Gia Kalakto, Quebec Midtown.
Megan Dooling, Nunatsiaq News. You said that you're not announcing an opening up plan today because of stakeholders and partners, working with them to contain. Can you give us any more information on what's going on? Who are your stakeholders and partners?
Megan Dooling, Nunatsiaq News, kunyo kakao gabita ko, matuyataw jangi kay nang ata, kasuyaw balya jangi kay nang ata, tako ilaw kataw gali, katudya kataw gali, kiko mata, tayo maakaw sa kakaw yati.
Not in great detail, but it's a wide range of partners. So there's other government departments, not just health. There's the Workers' Safety Compensation Board because they're creating guidelines for workplaces. There's private companies and non-governmental organizations. So not necessarily me, but people from the individual staff, from the Department of Health have had contact with a wide number of organizations and working out what they need to be in place and how much lead time they need to be able to open up.
Inalo na lo atang itakalawa ka kisani asing iniga pamakuni pili review yut anne hamnang itulirikut asingit takwalo iqanayartino aanertunu nalliukkumaaliqiyikut iqanayarbiu yunimitsaanu qauyigaarbiu khatta ila qauyigaarbiu gaaqarmimmata nammini qaqtiuyut gavamakkunniingaangittu timiuyut takwalo iqanayarti anne hamnang itulirikku amisuni gajigiingittuni timiuyuni uqaqatiqarsimayut ammalu qanutigi sivungagu qauyikkartausimagiaqalaamangata matuiqpallialiqutta.
You said previously the 3 requirements that you're looking for in order to loosen restrictions, no cases here, diagnostic capabilities, and then you were looking at what was going on in the south in terms of community transmission, but you didn't have an idea at that time of what you were looking for. Do you have a more clear idea now of the levels that you're looking for in the south?
Uqarsimagapitaakku apingaassuut maliktaugiahang mata ila saqqirsimagiahang niangatataakkua matuiqpalliagunnarsi niaqutta suurlumaani novatjuannaq 19 hangitsiarluni qauyissaqutiqatsialerluta ammalutaana pingajuaqallunaani suurlu siarmapallialuaqunni qata taima matuiqpalliagunnarsigajaqatsi taana tukisigiakkannerunnaqiu qanutigi qallunaani siarmapalliagunni qataima ismagigajaqpiu.
I had clarified that to ease internal restrictions or the measures that we're using internally, we'd be looking at 2 out of 3, needed at least 2 out of 3 to get to that point. As far as opening closing down the isolation hubs and getting rid of the travel restrictions, at this point we need to see there pretty much no community transmission in the jurisdictions in the south that Nunavut commonly travel to and from.
Tukisinartigaarlugu tamaani Nunavut iluani taakkua pidjutiqartugut maqqu saqqiumaliqqatik pingasuulingajuni isumarsarsiurutiqarajartugu taakkualu matujaugajartu kisiani qallunaani tujummiviuni tuuviugiartu qattartut siarmapalliagunni neqqatataunani ammalu taakkua tikiqattarunni titausimayut matuiqallialaarmiu kingullerpaangu qataulutik malu Nunavummi taima matuiqpalliagunnarsigajaqtu taima siarmapalliajuqarunni qanunavummi upagajuttanginni qallunaani.
May I please ask Minister Hickes a question? Do you have those numbers on hand for the amount spent on special warrants?
Minister Hickes taakua qatsiumangata kiinoja mauna tuina toqtaussimayu qatsiulaqla nalunaiqtausimaleqqan.
Thanks, Megan. I briefly mentioned it the other day, but approximately $5.8 million on the airline and a little over $1 million on the school food programming to make sure that there is food available for the children, school-age children across the territory. Those are the 3 special warrants that I've signed to date.
Rinnamik taana 5.8 million nalunaissimayavu qangatayuuleriinu tuniyawissimayo ammalu 1 million ungataani raarjuttu taakkua ilinniartinu neriyatsaqartitsiqattanammu taakua pingasuulingayu.
And you said previously that the money spent on the isolation hubs was a good investment because it kept COVID out of the territory, or it has been. Would you say then that in the state that it's in now, Nunavut would be underprepared if COVID were to be here?
Taakua kiinoja toqtaussimayut tuyomivimiititsiqattanermaani tailiviuyuni atuutiqatsaarneraqavigi kiinoja tamanna Nunavutjuarnaaq tikingilaqissimammat taakua atuutiqarsorivigi tamaanga Nunavummun.
And that's a valid question, Megan, and I think it would really be dependent upon the circumstances. As both myself and Dr. Patterson have mentioned in the past, if a number of communities were to have positive cases simultaneously, it would very much stretch our resources. If it does come in on a 1 community basis or 2 community basis, I feel very confident that we would be able to adapt.
Atjigigayangimmata saqqirsimayut suurlu Nunavutjuarnartaartuqarneqqataakkualu taa Patterson kuqaqatigitsimammatik qatigiqattangati atjigiingittuni nunalinni tamanna Nunavutjuarna saqqirneqqaat pilerijjutissani amigasililla gayartugut kisaan atausang mimakkuniluni nunalini taima napadjanartutaarneqqaat nalokkutingittu taima kamatsiaqunnaqiarningin.
In addition to that, I would have to say that it would depend on the community population as well, how cooperative the residents of impacted community were to adhere to the recommendations and guidelines. As in Pond Inlet, when we did have that false positive, the community was very accepting of the parameters that were dictated to the hamlet, to the municipality. The leadership there was phenomenal.
Hakaniga gutakkualuat nunalin nikhatsiu mga ta inungi atuti ila atuina khagayarmiyok amalo khanutigi tusat sa mga ta maliktaw kaktaw gialinnik sulumit simatalimitay ma tammaktaw yumi nalunato hakaina tillugu tappani nalat sa tupalo yung mata maliktaw huyaw simayuni tay malu sibulikti khatsia yung mata malit siya kung na yung mata tay ma ako gumagayak diwa singin nunalin ni.
Jackie McKay, CBC News. My question is for Dr. Patterson. Are you able to say right now how many people are quarantining in Yellowknife?
Jackie McKay, CBC kuniluta Patterson mo khatsyo mga ta Yellowknife mani taili titaw ito yung may binyo kakunak.
I don't know if it's changed in the last day or two. When I checked earlier this week, it was 44, if I remember correctly.
Asid just mga kawing ito nga kisani takunayalaw ako but sani 44 ngulaw to.
And I don't know off the top of my head how many of those people were originally treated in Edmonton and then transferred to the hospital in Yellowknife and then discharged from there. Those people have to wait the full 14 days from when they were transferred out of Alberta before they can be cleared to go home.
Kawing mga ito nga katsulata mga tatay ko tay kanito na Edmonton minga tuminit Yellowknife mo nutirtaw yuminit kisani tako Alberta minga simayu suli ullo ni 14 ni anitayli khattaya khannerto.
And so the people just in Yellowknife, you're trying to send them home earlier?
Yeah. Take Yellowknife meet to an angakatitaw sa kasakto.
Sorry, yes.
So now the testing machine is up and running in Rankin. Is that currently being used to be tested, or will that only be used if COVID shows up in that region?
Dahil nakawya sa kutiyo kang sinagmiato inawlang nakakawgaviw atok taw hatalaka ubalo kisani no padjar naktakto hakatok taw lekayaka.
We'll use it in the same fashion as we're using the machine that's currently here in Iqaluit. We would use it immediately or on very short notice if there was a critical need, somebody who's high risk or in congregate housing, but have it on standby in case we get a positive case in our regular testing mechanisms.
Tay ma chay natok taw hatam nato halon natok taw hatangat atok taw giakat saw tigilan nekha atok taw hatalak to so lolo kaya nakdumin nek saw yun kawi sa taw hatalo ni amalo illumiyo hatigi kasakta haktilugo tan duwa jana to halam nek hatta ta atok taw gin na hatali kayang meyo kawi sa kutiyo.
The mines have been talking about their own testing capacity, but would you let the Iqaluit mine send swabs to the Rankin machine if they needed to?
Kana kawi sa kutiyo atok taw gun nalakate ko yakam natik kuno ay ni ko kuno kang sinang meter.
If their machine was malfunctioning or they had trouble with it and they had concerns that somebody had symptoms, we'd certainly entertain that, and that would be a mine would be a high-risk area where we'd need to know right away. But if their machine is running and working properly, I'm not sure that it has any value added because it would still have to go south for confirmatory testing. So it would depend on the circumstances.
Tako kaya sa kuting awyan natiku akong iliyo ti hakat ubaluni no kadyo anak to haksurik sigutik atok taw kakon na sa kayak tabo yang natikun pilo akto may ulo kaya anak narsamigun naktunut kisa nila kaya sa kuting hanwing ipatay man halo na sa katta kayak tigo awlak taw kanerlo ti halo na ano lalo na taw gaya kanner katarlo ti kaya sa kuting miniyugalo tamani.
With the travel restriction still in place and travel, even though it's still not recommended, if I wanted to go boat around in Yellowknife this summer, would I have to quarantine and come back?
Yes.
Okay.
Oh, sorry.
Tako laga kangit pizza tigil lugi Yellowknife mo sulo ta na ayak ko Yellowknife mo kumaguni na ako ulo ni 14 na ni tayliga kakayaki ba.
One thing, and to clarify that, I think you might not even be able to get into Northwest Territories because you're not a resident. They have their own border restrictions that are almost as stringent as ours, and so there's that issue as well. We may work on creating more of a bubble as time passes, but there's challenges to that, and right now our biggest focus was on making things as smooth as we can for medical travelers.
Ito kasi naktigar lugo. No na siya malay siguro nang ituin nakahati taw gayak to ti tay kwat taw na minute no na siya may taw ngituni tikit tay lititsin matatay matigi uvago titu sangi unique malitaw kay simamata. Sibunik kanitid na itay ma awlakat tabiw kung nasigayak tut sa uyugaloat kisya ni maanaw yung tukaga ito akagatigo maanaw bilang simayot akakayam na sa siya kulugit.
Knowing that we're going to get more details next week about the reopening plan, business owners have been asking, though, that knowing this is coming, that they need to start preparing. Are you able to say what kind of business owners should start thinking about getting their businesses ready to reopen?
Iluling itako matuya pala na mo hasutit si pala na mo pinasako si ulak tumi narunay lang ang nakakawagigit. Aperiyo ka katalang nalya tako matuya tayo kayang mga tayo upalong ayak kung nakulugin nalya kano ito namin nakaktiyo matuya tayo pala kalakan.
The goal at the end of it is going to be to get all businesses open. Workers' Comp, the Workers' Safety and Compensation Board has created a number of documents that can help people with it. And I'd encourage all owners and managers to start looking at those as early as possible. We're going to start easing, planning on starting to ease the restrictions on June 1st, and I'll stop there and let the translation and talk more.
Tukaga kaktigo tayo mak sulo tako kanayak tinoanak tuning naliw kumali kayikot tukisige ako tiniakit siya sa malaktiwi kayo tawagon nak tuning namin kaktiyo yunut tako namin kaktiyo yun awlat siya yung ilo kami ko pala kulik tayo katamag kuning atay man na June 1 pigarlo ni matuyak tayo pala sila nga tayo kisugalay.
And it'll likely be a week after that before we open up to more businesses. And then after that, every 2 weeks, we're going to give it 2 weeks, do a reassessment, and if there's no changes in COVID activity in territory, then we'll carry on with easing restrictions in a stepwise fashion like that.
Pinasa ako sa mataw sa make sure lumatuyak tayo yung katakok. Pinasa ako si Mako kaway sakta talik ko tako kano yung Iqaluit mga ata ang maluasid jik si mayo hangi panuwa jo anak 19 tak si mayo hangi patay mga Mako pinasa ako si nagay pata matuyak tayo pala katalak to at siging ito.
Thank you.
Ken Driscoll, APTN National News. Dr. Patterson, you covered the Yellowknife numbers. I'm wondering about the other quarantine facilities. How many people are currently in those, and what's the wait time like to get in?
Ken Driscoll, APTN Iqaluit Patterson, tako katsyoning in the Yellowknife may tunalo na kawagabigit asingin nila katsyo vatako tuyok may vimeo takiyo.
I don't know the numbers. I happened to find out about Yellowknife this week because of the plans around removing that, the requirement for isolation. My understanding is that the only hub that has had times where it's had a wait period to get in is Ottawa, and it's down to 0 at this point.
Kaya mangito katsi mga tatana Yellowknife mi kaya laki laok to tana utakki kay nakatara hangiti taw tilugi khimik putilugi ta kay no tu titaw gali tana le utakki bitu khatalok to arwa mi tata khatalaw ngata kisani man no utakki yok ta hangito to yok mi bil mo galin ni.
And infrastructure projects in communities this summer are going to need the approval of you to go forward. And I know Iqaluit has come forward with their list of priorities. I'm wondering what other communities have come forward and what are some of the criteria you're looking at as to whether to approve people working from outside the territory on those large infrastructure projects.
Ako akito yutino pilirango na akto yak sana yaw galit ang yaptaw kakatara hamna ang ata ilinut ako lututirak si mayoni ikalum ni nalunay si simalang ata kisut sana yaw ka pala na mga ata asing idlikiano na li kano ito ni pili review na katamalo kisu na ato kakara hamna kamalik taw galin ni.
Just to clarify, it's not entirely up to me. It's also up to the hamlet, the community that those projects will be working in, and staff from CGS have been working with the hamlets to help identify high-priority projects. The people coming for construction work will all be required to go through a 14-day isolation in separate hubs for the most part. We're setting up hubs in Quebec and in Ottawa, in addition to the ones we already have that are strictly for the commercial workers, so that Nunavut aren't delayed in getting home because of this work.
Tukisinaktigang lugutan na tatsumato aulangin bagong kisanitaw tako hablakut ang eksmakatariahang nangata tako gavamako nunalin ni gavaman lupit serautik ko pili revingi pili khatihat sertu nunalin ni kisuni sivuli jikhoyi mangata tako alusana gatok to sulu ilulirti uluni 14 ni tuyo mi vimiti taw khatam nertu imiko khatam nertu sulu Quebec mi Ottawa mi lutamako sul kingo ba kaya hatta kunagi utakhi bagirtu tamang nga kasoaktu sulu anar bilak sa mayumini.
And if a hamlet has concerns, we'll work with them to address those concerns or delay the project. I'm not sure if Minister Hickes had more to say.
Hamlak ko ila isumalo ti kata pili khati gunat siya kayak tabut sul kingo ba kayak taw ga kata ilangi pili rat sayo.
I don't have a lot to add to Dr. Patterson's response, but I do want to emphasize on how important it is that Community Government Services has been working with and working to help address any of the concerns that hamlets or the residents of those communities have. And I can't stress enough that with the isolation hubs that we are establishing for these contractors, it will alleviate the majority of the concerns, as well as we're looking at some stipulations of the contractors or the construction workers once they get into the community. So hopefully that will alleviate any concerns and we can move ahead with any construction projects that we have planned.
Nalo na yung lugutak ko no naliniga pa magkunilo piyit sa katik ko pili khati khatsang ata hamlaw yunik so lo sumalo ti kata pijuti gilugi tama ko alo ino to view yu to yung mi view yu imiko nga katalak to contractor sa mayunot tay mai sumalo te o kinagit no nalin no khatam ningin nulo pili khataw sa kayak to khawik khataw sa simaluti tama ko sana yaw gali kayo sigaro taw inulogi.
Rajni Sharma, Nunavut News. Dr. Patterson, are you at all surprised that COVID has not arrived in the territory yet?
Rajni Sharma, Nunavut News Kumnik. Tapay si mabi suli no vadjuang nakto karingin matamani suli.
Yep.
Okay. All right. Next question. Last question. Now that Yellowknife is, like people, medical travelers don't have to self-isolate in Yellowknife, is more effort being made to send the medical travelers to Yellowknife for medical purposes?
Tana Yellowknife, miyan na bilang si majuit, tuyok mi vimi 14 nit, Utakia tu jago ne ang ata tayo mana bilayat sakata na saulang alikisi Yellowknife mo.
Not that I know of. That's more of an acute care decision. Dr. DeVette and Jen Berry, the Assistant Deputy Minister of Operations for Health, that'll be partly up to them. Patients may request referral to Yellowknife instead of going to other jurisdictions, and that'll depend on a number of things. So it's possible, but we haven't made a concerted effort on it.
Takwa luta no kisani so luta David amma luta na minister tugliata ikayok tinga isumali ako te hakayak tu tamakkuninga na beleak tudlo Yellowknife mo nga hatta ko matuin na reali asingin hallo na no ngingalutit tay mapiri hatta ko natut saubo.
Megan Dooling, Nunatsiaq News. You said that there's 44 people in isolation in Yellowknife now. I'm wondering if you know how many medical travel patients isolated in Yellowknife since it became a requirement.
Megan Dooling, Nunatsiaq nita ko 44 ngone kakauga vigi Yellowknife me ani tayle yoto yo me hatsu simalang mga tawlo me mo kawi mabe.
No, I don't.
Aga.
Okay. I also have a very specific question, but I'm just looking for a general answer. There's an Inuk who isn't from Nunavut, but he has family here, and he requires medical help, and this family here is the only ones who can help him with that. He's applied to come here. Generally speaking, would an exception be made for cases like this?
Tana naluna sumayo mapikutili inutahangago Nunavut miutaw ngito galawa kasi ani tamani ila haktuni amalo inuli saktaw hattara hasuni kayoktaw hattara hasuni tuksarak sama tamaw nga ko maluni tayo ay sumasaksi ko tiyo kaya kata na tikititaw ko ng mga Nunavut mo.
We've made exceptions for some reunification of family under certain circumstances, and the biggest factor has been reuniting parents and minors one way or another. But adult children or others that have been living apart, we have not made those exceptions. So bottom line is it's on a case-by-case basis.
Ang ikum na hatas sumayo ko ilagi katigo matilugi tikito kaya hatilugi ilagi jaw yuni pilo akto me ang ayok kaya yut amalo so sila na hitongangin ni kisa nili innam ne hitongangin ni tay maangi hatta ko naksumangit tugo isumalo te hamo sa maktailit sinami.
I just wanted to clarify, for COVID tests in the Iqaluit, would you send those to Iqaluit or Rankin, or would they go somewhere else?
Tukisanaktiya ko na no Joanna 19 hawi sa ko tiyo yo kitik me ni ngartut kanya silang mo katalang avaw baloy kalunno.
Right now, we would send them to, for the general investigations where we're not dealing with an outbreak, we would send those to Alberta. If we detect a positive case and we deploy a rapid response team, then we would run charters from whichever community in the Kitikmeot, either to Rankin or to Iqaluit, depending upon where they are and weather.
Mano yok ila tamakko haw isa ko titui night suli Alberta mo taw katalang ayuk kisa nilino ba jo nak tuhan ne haw yigut ta kwalo to aver nak tuni ikayo kaya titaw yut charter ko awlak ti chakata kaya to kang sinak tamalo ikalon no tamakko ni haw isa ko tiyo galen ni.
I'm just wondering, now that we have these two gene expert machines in two regions of Nunavut, why that's considered Nunavut-wide testing, even though we're missing a machine in a region?
Tako makulang ati hawi sa ko tiyo gene expert nuneraktaw yo makko navitok simawiyo yuni sumalatang yung nakatalik hingilang ano na vumipita haktin na gukitir meuni.
because we can still use the Gene Expert in Rankin Inlet in the exact same capacity as we're using the one in Iqaluit to support surge capacity for the other half of the territory. And the way that the lab was designed and built in Cambridge Bay, it does not have the capacity to run either a Gene Expert or a BioFire device.
BioFire?
That's the other one. There were 3 devices that we've been looking at, and the Gene Expert's the one we've been able to get online first.
Pinani tayo na kangasinang mito tayo matsay na ikalon ni kaya sa kutiyo yut ito atok tawag nang at sulami sa ngukalan katakaway sa kutiyo yut atok tawag katakon na kaya nga tayo nalo ikalotut sa ame awang iksibi kaway sabi nga naman ang ilo ang atamak ko ni nga Gene Expert unikaktaw yun ni Amalod BioFire kaway sa kutinik naman ang ilo ang atay ma kaway sabi o katakon na kaya nga.
Thank you.
Premier Savikataaq has asked Minister Hickes to reread his update just because it wasn't couldn't be heard on the live update. So I just have a copy for you. One for you, one for her, so she's free. Sorry.
Thanks for your patience, everyone.
I'll do my best to give the Premier's comments as due justice. Good afternoon. There are still no confirmed or probable cases of COVID-19 in Nunavut. Today, the total number of people under investigation to date is 972. 223 people are currently under investigation. We were hoping to unveil our reopening plan to ease restrictions and measures today, but we are still finalizing some elements to ensure the safety and well-being of Nunavut. This needs to be done correctly to ensure our plans will be successful and work in Nunavut for Nunavut.
Kasi bulat tayo ka usirik ko yang ito saktaw ning mata ilangin not uno sakot suli nalo na taw si mayo hangitok ubalo pa sa giyaw unik no kadyo anak 19 hangitok suli no na bommi ulumi katilugit ka saktaw si mayo 972 223 suliman na ka saktaw ning ipiyaking iton naroon na sigo makaw galawak tigo matuyak si Valleana mo kaso si Valleana mo paknaw titinik ulumi kasi ani piyakir taw Valleana mata ilulingit uluganak tumili kunagi kanwili kunagi luno na bumiyon tayo matamangilo ta pilirit siya ako magatta paknaw tibulo kayo sit siya ako nakulog itamani no na bumiyon.
Thank you for your patience as we complete this important work. Our aim is to make this public early next week. In closing, I want to acknowledge the boredom and weariness we're all feeling. COVID-19 fatigue is real, but that doesn't mean we should let our guards down or ease up on the good work we're all doing. If anything, Nunavut's measures show that staying attentive works. Being tired or bored doesn't mean this pandemic is over or that we should take it easy, and I'm recommitting to working hard and staying strong. We all need to do this together to keep our communities safe, and let's have each other's backs and be responsible for one another. We will be back Monday at 11 a.m. for our next update. Have a good weekend.
Kuya nami kutakhigon nat sa simagatsi pili katawlo si tama tuminga pimakayalo yumik tuwaga kaktigot tayo pinasa ako si ulak tumi matuya pala ng munalo na ilaktabu piyaki ako tigilogo ilisa ila kawya magalo akto nga ikiangulak tuni kamalo takalik tuni taman nanubad jo anak 19 to sangunat siya nga tamalo sulilo ni ariyo nak ninga kasi ani suli ipigusot siya kaktigot tayo maatsuro tigayatin ni nuna bumi malitaw gali tayo malitaw siya ningin nuna lunaktaw siya sa mayon takamatuin naknik ikiango nakniklo tayo may kaluak tilugo kasi ani sulitaman na siya mapaliani nga sumalon nangan tayo maatsuro tikakan ng nakto nga amalo sangiyot siya kulusi tayo makatudjilo ta piliri katigiga kaktigot nuna libot at tanak tumili kunagit ikayo katigit siya katakta amalo piliri katigit siya lota utilak tigo naggadyaw may ili apa may ulasakot kingulang may tusaktit sigalang may luta pinasako siyo nungwani kubiasan na kasi.
And just in closing, I'd like to take a comment just to follow up on one of Jackie's questions earlier about going to NWT to go canoeing. I think it's a real opportunity, and I've had a number of people that have brought this to my attention, that their summer plans are now interfered with. There's people had plans to go to other jurisdictions for summer holidays, visit family, and those jurisdictions, almost all jurisdictions across the country, have some type of restrictions on entering their province or territory.
Tana kiugiakkan ni komea solo nunat siamo tay na umiakto manera kayo tay ma jiging ito na pero yaw hatasi mamma aw yakku paknaw tiulo walo akto ni kalunanu laks umayunik tay mataw kanata mi asing yavitul si may ni balik taw galin ni nalunan sis mammi mata.
And as the restrictions start easing on inter-community and in-territory travel, I just want to take this time to encourage everyone that your summer plans don't necessarily have to be thought of in a negative light. There are many outfitters and many operators across this territory that would love the business right now that they're losing from the lack of tourism that is going to be occurring this year.
Aula kata na nang masingin no kisani ukau jiga ko mayung akikulimani tako au yakut pamnaw tingit tay may naron ne kalwak tilugit kisani tana isumagyaw gyang aron nak tamak ko aula katak titsiyud pulakat tulirin ang mullo tamani no na vummiu ikayok taw ngaron nak sigayak tumanaw ipiyat sa kangim mata pulakat tini tikit to kakatangin ning ano.
So whether it be hunting in areas where you normally wouldn't have hunted, going to look at walruses in Sanarayak, or going into the Coppermine River out of Kudluktuk, or visiting the Kitikmeot, different areas in the Kavalik, I strongly encourage everyone to take a look at exploring our own backyard. We have an incredible territory that people spend thousands and thousands of dollars to visit, and we don't necessarily have to leave the territory to have a fantastic summer holiday. Thank you.
So luang na suga ako magutik o balo ay vernik tako kan narak to maguti sa ni kayami holok to milokongin ni tako giak to lutik o balo kivan ler mina mituin na tamako kaya sa katsa matanu na wilo ani to kadjanak tuit tamako kinaw ya kasalom ni kinaw ya linnot atok taw katang atako yaw giak to suti asingin ni ngak to Nunavut tay may gunnak medyo tamani no natin namin.
And just, I guess, in closing, I'd like to encourage all operators and outfitters across the territory to look from within as well. I know we spend a lot of time marketing outside the territory, but let's take a look at our own residents and see what business opportunities are available to help sustain this great industry that we have in this territory. Thank you.
Iyari ko tigilugo tamakwa lahat tak tisiyo pula katinilo kamayo hatak tu tay mali ukau tiga kayak tak tamani no na vummiuni au lahat tak tisiga so nga hullu tamakwa lo nammene khatiyo yo no pibale ko taw gunang at tamani mi taw galo ano atok taw nga khatak luting.
Not coming.